And to walk us through the rising number of deaths recorded in Lagos isolation centers is a public health consultant, Dr. Nseabasi Ekanem, who joins us live via Skype from Lagos. Good to have you join us, Dr. Ekanem.
Thank you for having me.
So let's start with these figures of the number of deaths in the Lagos isolation centers. We have them put at over 500. But when you look at the numbers released by the NCDC, it's around about 48, I guess. It doesn't tally. So what could be playing out here?
Well, there could be a challenge with regards to collation of data and all of that. But the truth is that, yes, the number of cases have gone up, and yes, the number of deaths is fairly as what we have been told. It's actually true. I am saying that from experience because I also lost a patient too, two patients to COVID-19 in the past week. So I don't think it's anything to, we don't need to argue about the numbers. The numbers are really high, and it's a huge constraint to us. So I think what is important is the fact that we've seen these cases. How do we address them? The cases of COVID-19, both the mortality and of course the morbidity, is really high, and we need to take a different step at this time to see how we can contain this the spread of this new variant of COVID-19.
All right, so now that we are recording more deaths, because I mean this is a lot, 500 deaths in Lagos alone, and this has been blamed on the fact that inbound travelers are cutting corners in terms of COVID-19 guidelines. What can be done about that?
I think there's a risk. I think there is need for airline companies to actually come on board and stand their feet, because we've seen that lots of people who come in, either they use a fake identity in terms of its fake test result, or some of them actually boycott the screening process. Some of them even probably get a fake identification that they have taken the vaccine, that is a fake vaccination certificate. I think the airline, the Federal Aviation Authority, all relevant agencies should enact or probably implement more stringent screening measures at the port of entry. People should be able to show genuine, either you provide, you subject yourself to the screening. And in fact, at this point, I recommend that anybody that does not subject his or herself for screening should be considered a criminal. It should be a criminal offense. After all, it has been signed into law by President Buhari that everyone that comes in from other countries should be subjected to screening, so that we will not have more imported cases of COVID-19 in this country. All the relevant agencies must work together to make sure that there's transparency, there's accountability in the entire process. Everyone must be screened. Nobody should be, exempted from this. That is the only way we can actually make this in the port, because it's becoming a serious challenge for us.
Absolutely, Dr. Ekanem, really worrying and very serious. And when you have 500 deaths, and this is linked to inbound travelers, and two countries stand out, South Africa stands out, travelers from South Africa and travelers from India. Should we be restricting flights from these countries, or should we have special protocols to say, if you're coming in from this country, you must isolate, and we must monitor the process of isolation?
Well, I think what we need to do, first of all, is that we need to communicate. I think both countries have to talk. We need to communicate, because from the country you are coming in, there should be proper screening. And then when you come in here, we must ensure that you undergo the screening, the isolation, and every protocol. In fact, for those two countries, what I recommend is that anybody that is coming there should be considered COVID-19 positive until proven otherwise. That is how we should treat anybody coming from those two countries. He is a COVID-19 positive patient until proven otherwise. And that will give us the impetus to make sure that they are screened properly, because we cannot continue to harbor new imported cases of COVID-19, which is undermining the achievement that we have made so far as a country. We need to be very stringent in these measures. That's my recommendation.
Thank you so much. This is quite worrying. We hope that everyone takes responsibility for ensuring that we are all safe from COVID-19. Thank you so much for talking to us, public health consultant, Dr. Nseabasi Ekanem.
Thank you for having me.